Hello, I'm Dr. Steve Hotze, and I'm going to talk to you today about polypharmacy and how it's poisoning Americans' health. When I graduated from medical school, we had a party after a dinner reception that my dad threw for me at the Houston Club in Houston, Texas. This was in 1976. And as I sat beside my dad at the dinner table, my dad turned to me and he said, "Son," I said, "Yes, sir." He said, "Don't poison all your patients like all the other doctors do." Now that was a seed that my father planted in me, in my brain, that over time has given birth to the Hotze Health and Wellness Center, Hotze Vitamins, and the Hotze Pharmacy, and natural approaches to health. So I thank God for giving Dad the insight and the common sense to tell me, don't poison your patients like all the other doctors do. Now, I wanted to show you something out of the Wall Street Journal. Look at this. Headlines 2 days ago in the Personal Journal, medication overload. I could have written this article. I've been preaching about this for decades on the radio. You know, my current radio program now is on KPRC 950 AM, and that program is from 1 to 2 o'clock, Monday through Friday. And it's called Dr. Hotze's Wellness Revolution, because I'm leading a wellness revolution that's going to change the way men and women are treated, no matter what their ages are, by natural approaches to health, so they don't take pharmaceutical drugs which poison the patient. Now, this article says that 67% of older patients, I don't know what that means, 50, 60, 70, are on 5 pharmaceutical drugs, some of which they can now buy over the counter, like Prilosec. It used to be a prescription drug. Now they make Nexium, which when it breaks down, it gets turned into Prilosec. You can buy it much cheaper over the counter. And there are antihistamines and a host of other drugs that used to be prescription drugs over the counter. So on the 5 different types of drugs that people use, some are prescribed, some now they just buy over the counter. And those drugs are toxins. Toxins, why do I say they're toxins? Because in my first class in medical school was pharmacology, and in the chapter in that book was on detoxification of drugs. Detoxify, that means remove the toxin. To get the toxins, the drugs out of your body so you can excrete them in your urine. Get rid of the toxins, that's what it means. And the liver is the detox organ. Well, the root word for detoxify is toxin. And if you go to the dictionary, Webster's Dictionary, first definition, toxin means poison. Drugs are poison. They all have an LD50, a lethal dose at which 50% of the people taking a specific dose will die of the drugs. The third leading cause of death is iatrogenic illness. What is that? That's doctor-caused illness, the vast majority of which is caused by drug overdose, not or drug misuse, drug interactions. It's caused by drugs not that the people overdose on, but the doctors have prescribed that cause toxic effects, lethal dose 50 effects that cause the patient to die. And it's the interaction of these drugs, the polypharmacy. You know, when you go to a doctor and you have symptoms, the doctor calls your symptoms a diagnosis. If you come in with joint pain, he says you have arthritis. If you come in with high blood pressure, he says you have hypertension. If you come in with elevated blood sugar, he says you have diabetes. If you come in with headaches, he says you have migraines. If you come in with chest pain, he says you have coronary artery disease. If you come in with you're overweight, he says, well, you're obese. All these are labels, and this is a disorder that doctors have, a disease doctors have, and I call it labelitis. They take the disease or the symptom of the disease, and they call it the diagnosis. The diagnosis should be the cause of the symptom. So if your doctor tells you you have hypertension or diabetes or arthritis, your question should be, what's causing it, doctor? Why do I have it? What's the underlying cause of this problem? Well, they call the label of the symptom, they label it, and they say that's the diagnosis, and then they immediately give you a drug to treat that symptom. So we have medication for migraine headaches, we have medication for joint pain and arthritis, we have anti-arthritic drugs, anti-inflammatory, we have drugs for irregular heart rhythms, antiarrhythmics, we have drugs for allergies, antihistamines. We have drugs for stomach problems and gastroesophageal reflux and bloating, belching, and gas. If you have if the doctor says you have irritable bowel syndrome, we've got drugs for that. If you got urinary tract problems, we've got drugs for that. If you don't think well, if you got dementia or you got early Alzheimer's, we have drugs for that. The question is, what's causing these problems? So doctors have a drug that the pharmaceutical companies have produced to enable you to try to solve the symptom. The problem is, you have your problems for two reasons. One, you don't have the proper vitamins and minerals and nutrients in your body because, one, you're not eating right. You're eating a high, simple carbohydrate diet and sugars, which cause inflammatory products to be produced in your body, which damage your cardiovascular system, particularly the coronary arteries, but they damage every cell in the body. So you have a toxic load on your system and from chemicals in the environment. So you have two things going on: vitamin and mineral deficiency and toxic overload. The toxic overload comes from environmental products in the air we breathe, the foods, packaged foods we eat. If it's in a package, can, or box, you shouldn't have anything to do with it. In the soft drinks we drink, especially the diet drinks, we've got aspartame, which is a neurotoxic substance. And we lather our body with all kinds of lotions. These are all petrochemical products that are toxic, and they cause the cells of the body to become toxic and cause you to develop symptoms. Your cells are toxic, so you go to, and these symptoms, you go to the doctor, and his solution for your symptoms are more toxins. He's going to give you the poisons, the drugs, which enhance and cause worse problems. So you got elevated cholesterol, he's going to put you on the statin drugs, but the statin drugs poison the liver. You need cholesterol. You need cholesterol for good hormone production. You need cholesterol for your myelin sheaths, which wrap around the nerves. You need cholesterol for good brain function. Cholesterol surrounds every cell membrane. It's important for cellular function at the membrane level. Those statin drugs poison the little engines inside your cells called the mitochondria. That's the name, mitochondria, which is like a little factory, a little engine inside your cell that takes the energy, the fuel, which is energy, glucose and fats, and converts it to energy. It takes these substances that we digest in our system and get in the bloodstream, and it takes those products and it converts them into energy so our body can function well. But if you take drugs, particularly statin drugs, they poison the liver, they poison the cells, they destroy your ability to make coenzyme Q10, which is a critical molecule that the body makes in order to allow the mitochondria to produce energy. And so it poisons that. You get on all these blood pressure medications. Oh my gosh, the calcium channel blockers affect the brain function. They cause, on x-rays, white matter production in the brain. They also lower your cognitive ability. You don't think as well. You're in the calcium channel blockers. They increase the risk of heart attacks. As a matter of fact, in diabetics on calcium channel blockers, guess what? They have 1,000% increase of heart attacks. So the treatment really often is worse than the disease. They have a host of drugs that they want to fill your body with, which are toxic. So what's the solution? Well, most people in America are overweight. Your chances are, talking to you, 66% chance you're overweight. If you're overweight, guess where all the toxins store? They store in the fat, and then they're leached out of the fat and make your cells toxic. And why are you overweight? One, you're toxic, and your cells don't work right, and that makes you fat. You don't properly metabolize glucose. You get insulin resistance, and insulin then drives all the sugar into fat in your cells. So as you gain weight, what are you going to get? You're going to get adult onset diabetes mellitus, which is type 2 diabetes. You're going to get elevated blood pressure. The doctor's going to put you on medication for that. You're going to get cardiac arrhythmias. They're going to put you on medication for that. Next thing you know, then you got nausea and vomiting because you've taken these drugs, and you got muscle aches and pains, and they put you on non-steroidal anti-inflammatories, which increase the risk of heart disease. Vioxx was a model of this back in the 1990s. It was a non-steroidal anti-inflammatory. It had increased the risk of heart disease so bad that they had to take it off the market. But the people didn't have pain when they died, not in their joints. They had pain in their hearts. And this is how dangerous these drugs are. And this is what the article says in the Wall Street Journal. We got a problem with polypharmacy and medication overload. So I want to warn you about that you can clear this up by doing several key action items. One, clean up your eating program. Get on a Paleolithic diet, which means eat good fats. Eat your eggs. Eat your butter. Get plenty of avocado. Eat nuts. Take fish oil. Get plenty of fish oil. Drink cod liver oil. Take a tablespoon a day of that. Get good fats in your system. Eliminate all the processed salad dressings, because those come from vegetable products. They've been heat treated and they're very dangerous. They have trans fatty acids in it. Obviously, eliminate margarine from your diet. Eat a whole array of various green vegetables, the cruciferous vegetables, spinach, broccoli, kale, green beans. Eat a copious amounts of that. Eat meat. You can eat meat. Meat gives you good essential fatty acids and the essential amino acids your body needs to function. Eliminate from your eating program the sugars and the simple carbohydrates. Simple carbohydrate are starches like bread, pizza, pasta, potatoes, rice. All these are converted immediately to sugar because they're starches, and that means they have sugar molecules that are hooked together, and when they break down, they turn into sugar in the body, and it gives you a sugar overload, raises your insulin level. Insulin becomes resistant at the cellular level and drives all the sugar into fat, and you get fatter. You get big and fat, and then your insulin levels go up. Next thing you know, your glucose levels goes up, and you're on hypoglycemic medication, and then you're on insulin. If you're on insulin, guess what? I guarantee you've gained a ton of weight. Insulin will cause you to put on weight. You're already insulin resistant, and they give you insulin shots for adult onset diabetes. It's going to drive all the sugar into fat. Everybody I've talked to that comes into our office has been placed on insulin and has gained significant amount of weight. 40, 60, 80, 100 pounds. It's incredible. And they make them sicker. And the insulin is not cheap, as you know. And they have them oral hypoglycemics and blood pressure medication and a host of other medication to treat the symptoms of their problems. So get on a good eating program. Replenish your hormones, which is absolutely critical. The hormones are very important for cellular function. Get on good hormones. Get on good vitamin and mineral program. That's important. Vitamin C is critical for preventing coronary artery disease. You need to take vitamin C. That will help your body make collagen. Every time, if you think of your hand as the heart, and you look at a vein on it, consider that one of the main arteries to the heart. Every time you squeeze your hand, you see how the vein collapses and it's stretched? That's what happens in the heart 72 times a minute, 100,000 times a day. Imagine if we went out and stepped on a hose 100,000 times a day, every day. It would tear it all down. That's what happens to the arteries when they're inflamed. Inflammation from the toxins and from heavy metals and from the foods we eat that cause inflammatory products and from infections cause coronary artery disease. They get inflamed, they become eroded, and you have to have collagen to fix that. The backup, if you don't make enough collagen because you don't have adequate amounts of vitamin C, and I recommend vitamin C 1,000 milligrams per 25 pounds of body weight. I take 8,000 milligrams a day and have done so for 25 years. I've done a heart scan, which you need if you're over 40. You need to do a heart scan to see if you have any calcification in your artery. Guess what you need to do? Do that, and if you've got heart disease, then you've got to go on a very tight eating program that's Paleolithic, and you eliminate your simple carbs and your sugars out of your diet. So it's a eating program, it's a vitamin replacement program, or vitamin and mineral supplementation program with vitamin C, proline, lysine, magnesium, vitamin D, vitamin E, and other key vitamins that are important for heart health, minerals like selenium as well. So you take, and then you eliminate as best you can toxins. You don't drink out of plastic because it's got plasticizers in them. All these petrochemical products come in, down-regulate your hormones and make you feel sick. And then get yourself on a good exercise program, and basically that's going to help you get well. We see people who, first thing you do, start eating right. Second thing you do, replenish your hormones. Third thing you do is take vitamin and mineral supplementation. Eliminate toxins as best you can from your environment. Don't be cooking in plastic and putting in the microwave and getting all those petrochemical products out of the plastic into your system, which are hard to get rid of. If I did a blood test on any one of you, I guarantee you would have organic volatile solvents in your system. We'd pick that up. I checked my own. And guess what? I haven't drank out of styrofoam cups in I don't know when. But I've got high level of styrene in my body. It's a carcinogenic substance. All these petrochemical products are carcinogenic, and you don't want them in your system. You want to do a detox and get rid of them. So The solution to your health problems is not more drugs. A matter of fact, we use more drugs in America than any other nation in the world. We have 5% of the world's population. We use 42% of the drugs. Of the top 14 nations in the world on heart disease, we're at the bottom. We're number 12 in heart disease. And yet we got the finest medical facilities in the world that do bypass surgery, heart transplants, they put stents in you. None of those ever arrest and reverse coronary artery disease. It can be arrested and reversed if you have it by getting on a good eating program and taking the proper vitamins and minerals and nutrients that you need in your body. That's critical for you to do. Plus an exercise program helps you with good cardiovascular health. That's very important. The solution is not drugs. As my daddy told me over that table, he said, son, don't poison your patients to death. And that's what we're here to prevent you from doing and encouraging you to do a 180. You're barreling down the wrong side of the freeway right now if you're overweight. I promise you are. And even if you're not overweight, you're probably barreling down. If you're on a bunch of drugs, you're barreling down I-10. And guess what? You're coming to an overpass. On the other side of that overpass is a Mack truck. When you hit it, you're going to be dead or crippled the rest of your life. In health terms, that Mack truck represents diabetes, hypertension leading to cardiovascular disease, heart attacks, sudden cardiac death, cardiomyopathies, congestive heart failure, and strokes. I don't want that to happen to you, and you can prevent it, but you are the only one that can prevent it. You've got to do a 180, going down the wrong way of the freeway, swing around, get going the right way, and take charge of your health. We're going to be your health coach. You're the health athlete. We want you to get in the health Olympics. We want you to win a gold medal. We can make the recommendations. You've got to do the heavy lifting. So this is Dr. Stephen Hotze encouraging you to take charge of your health and do a 180.